we are developing this clinic that is called MAR clinic. MAR meaning Malformaciones Anorectales. I have seen the results. The results are amazing. This clinic is growing very fast.
In Honduras, crime and poverty are widespread. Access to medical care is limited. Children with special needs are at risk to neglect and delay therapy. Juan Caniotis, a pediatric surgeon in San Pedro Sula, has identified children with anorectal malformations as a special population in need of help. With the help of private donations, he has founded the Fundación MAR and allied himself with a privately owned charity clinic called Roof Pass to allow access for these children to corrective surgery and postoperative care. It's unclear if anorectal malformations have a higher incidence in poorer countries, but it's clear that the access to high-quality care is very limited when dealing with this kind of disease.
I decided to take care of the patient with anorectal malformations because they were left behind.
A colostomy performed after birth is the only chance the children have to survive. After this procedure, they are left on their own, and most families will never be able to afford further corrective surgery.
You need several studies. They are not cheap, and we don't do it in the public hospital. So I used to have a lot of kids with colostomies that needed the surgery.
Living with a stoma in this country is devastating. Schools will not allow children to attend, and the lack of education will further perpetuate the poverty cycle.
Cuando el muchacho me dejó mi hija, me la dejó de un mes de embarazo.
Yeah.
Yo me he tocado todo.
Yeah.
Yo soy la madre de él. El niño, yo cuando ella lo vino a terminar llorando. Cuando me llamaron a mí, me dijeron que el niño había nacido enfermo,
Yeah.
sin nanito.
Yeah.
Entonces inmediatamente me lo trasladaron para Catarina.
Yeah.
Allá me le hicieron la cosita aquí.
Yeah.
Después vine yo, el doctor él me dejó la cita para que yo viniera acá.
Yeah.
Entonces yo vine acá a abrir el expediente. De ahí él me le hizo el culito.
Yeah.
Ahorita ya él fue el encierro.
The correct repair of anorectal malformations require people with the skills and experience in this condition and delicate postoperative care. Mistakes and complications can lead to lifelong incontinence.
Here at Fundación Root Pass, I can do surgery, I can do the follow-up, and I can record some of the data.
To offer these children their best opportunity, surgeons dealing with this condition will gather for a week, trying to schedule as many children as possible.
We met about 4 years ago and started to do brigades. The brigades mean that we do only anorectal surgery in 1 week, and we can do between 30 to 45 cases in that week. Then I follow up the patients, and we can, like a program colostomy closures for next brigade.
Checkups after surgery are mandatory and part of the treatment. Juan Caniotis is taking loving care of his patients and ensure proper follow-up.
So it's very hard here in Honduras, people to come to do the anorectal dilations.
With donations, he will provide the costs of surgery, diagnostic tests and traveling expenses for the families of affected children. And our foundation has the mission of helping him with this noble effort.
The big problem that I face is financial, because I have to pay pediatricians, I have to bring some specialists in gastroenterology, nutrition. Sometimes the patients cannot come for the follow-up, so I have to send them money to come so I can see how they are doing.
A 3 horas en vehículo a 120, y pues yo he podido ver en la ciudad donde yo vivo que hay padres que por falta de dinero no pueden venir a a traer esos niños aquí a la fundación, o hay niños que ni siquiera los llevan a rehabilitación o una terapia porque no tienen para el viaje, para ir, porque los padres a veces no tienen los recursos para una cirugía, para gastos médicos, y prefieren dejarlos así, que se críen así.
Y las irrigaciones, ¿de acuerdo?
Y yo digo pues que la verdad las ayudas que ellos puedan dar pues se van a ver reflejadas en la alegría de muchos niños y padres de familias que van a salir recompensados con este tipo de cirugía.
And it's really doing a lot of difference for these kids. You know, they don't have any help.
And as a team, we believe in this cause.